everyone. We will wait for 5 minutes more. And if anybody else want to join us, so he can also have something with us. Yeah. Okay, we will start now. I'm Dr. Iram Ashraf, and I'm here today to discuss an important topic, which is AI and its implication in aesthetic medicine. I am Program Director in the University of South Wales in PT Cert AI program in medicine. Along with I'm tutoring dermatology, cosmetology, trichology, and anti-aging medicine there, along with other institutions. I am also from the international faculty in Rawalpindi Medical University. I am European Board Certified MSc in Aesthetic Medicine from Queen Mary University, London, with diploma in dermatology, along with diploma in mesotherapy from German Association of Mesotherapy. I'm working in a private practice in Germany at the moment. Before that, I have experience from Pakistan. This is me. And now let's start with our presentation. So today's agenda is, first of all, we have to know what subject we are discussing, like introduction, then fundamental of artificial intelligence, and then application of AI in aesthetic medicine and ethical implication. So in these slides, you can see that AI is everywhere. Whether we are using our smartphone, whether these are robots which are treating the patients, whether in the labs or having consultations. So it's all around. It's not like the previous one where we have only limited things that like ultrasound machines or something which are using like in 1950s AI was generated, and later on it has some development which is going on day by day. So this is something which we can see that now it's integrated in everywhere in every field of life. So why AI is important in aesthetic medicine? Just have a look. There, it's the Grandview research graphs, which shows that AI, there will be a rapid surge in AI till 2030. It's like in 2018, it will be threefold in 2030, means that the workload will be increased not only in European aesthetic market, also in Asia Pacific aesthetic medicine market, in Middle East and Africa aesthetic market, along with North America aesthetic market. So if something is like so much overburdened, so it's really difficult to manage it. For managing it, we need machines. Like we can take a simple example. Previously, our parents were washing the clothes, our grandparents, with hand. And then there was development and they need washing machines. And later, like automatic washing machines. Similarly, aesthetic medicine was generated and people start doing it. And as the workload is increasing, so we need some intervention to decrease the burden which is already there in private practices. So aesthetic medicine has traditionally relied on clinical scales, means that one person subjectively interprets something and then he decides some treatment. And in another practice, there is another person who is doing this same and will he administers some treatment, but this is all subjective one. Now, what happened? With this subjective interpretation, sometimes patients are suffering from body dysmorphic disorder, but sometimes the doctors are also suffering from it. So we got dysmorphic faces. To decrease this, there is a reason that we need something which is unanimous, which is by experts, and which can provide human intervention, aesthetic medicine intervention, which is totally required and according to the demands. It shouldn't be overdone. It shouldn't be underdone. It should be appropriate. Like aesthetic medicine, which was traditionally relies on clinical scale, has limitation due to subjective interpretation. That's why we need AI help. Then AI can overcome the limitation of human subjectivity by providing consistent and repeatable evaluation. AI's integration into aesthetic medicine is important for its capability to elevate patient's assessment and consultation. Now, talk about fundamentals of AI. Here, I'm not going to teach you that what AI is and how we will run some algorithm. We will basically tell you what AI is according to the need of the subject, so that whenever anybody come to us, we have some knowledge about the subject. Okay, yes, we can integrate with the AI experts and make smart programs or something which is really helpful for the mankind. Instead of that, it isn't like that I'm going to teach you everything like algorithms and because as my expertise are aesthetic medicine and dermatology, similarly AI experts have their expertise, but the problem is that what we can see that pitfall is that actually there is a gap between the communication. Previously, some work was done which was not up to mark because two domains are not combined together. The need of the era is we have to work together, and for that, we must have some know-how on the subject. So, AI or artificial intelligence broadly refer to the ability of a machine to perform tasks that typically require human intelligence, like learning, decision makings, problem solving. In computer science, AI focus on algorithm and data processing. And in robotics, it's about autonomous action. And in healthcare section, if we notice that we are using both virtual and physical AI. Like in virtual, we are using different data processing algorithms, and in robotics, there are different machines which are working like filler administration, botox administrations in our laser machines. Everywhere, we can see that AI is working and we are using it. Now it's machine learning. Machine learning is actually a subset of AI, which is a field of artificial intelligence that focus on enabling computers to learn from data and improve their performance on specific tasks without being explicitly programmed. It involves algorithms that can analyze data, that can identify patterns and make predictions or decisions. So types of machine learning is subset or divided into four further branches like supervised learning, unsupervised learning, semi-supervised learning, and reinforcement learning. Let's talk about supervised learning. In supervised learning, algorithms learn from label data to make predictions or classification. Then we have unsupervised learning, which means that algorithm discover patterns and structures in unlabeled data. Then we have semi-supervised learning, in which algorithms learn from a combination of labeled and unlabeled data. And then we have reinforcement learning, in which algorithms learn through trial and error, receiving rewards or penalties for their actions. Let's talk about deep learning. Deep learning is actually a subset of machine learning that utilizes artificial neural network with multiple layers, like deep neural network to analyze and learn from data, enabling computers to perform tasks like image recognition, natural language processing, and speech recognition. Now look at the diagram. There is an input, then feature extraction and mapping, and then is the output. Means that the data is given and then it was extracted and then output is there. A multi-layered neural network with a special architecture designed to extract increasingly complex features of the data at each layer to determine the output. Then, as we already told, that multiple layered neural networks like deep learning rely on the use of multiple layers of neuron, allowing the model to learn complex patterns and features from data. Then we have automated feature extraction. Unlike traditional machine learning, in deep learning, models can automatically learn features from the raw data, reducing the need for manual feature engineering. Then is the large data sets. Deep learning models often require large amount of data to train effectively. Then we have applications like deep learning has a wide range of applications, including image recognition, natural language processing, speech recognition, fraud detection, and more. So how is it implemented in our domain? Yes, we can recognize the patient coming to us with different problems, like if he is suffering from aging, we can rule out what sort of aging he has. Then we are using smart ultrasounds, so it's also towards the same thing. So its intervention is everywhere. Then let's talk about implications of AI in aesthetic medicine. Implication of AI in aesthetic medicine is not bound to one domain. It helps us in diagnosis and assessment. On the other hand, it helps us in training, treatment planning, and personalization, then device optimization and automation, and then patient communication and education. Like AI in aesthetic diagnosis and assessment, AI can detect skin texture, pigmentation, and vascularity patterns. And AI also help us to diagnose acne, rosacea, and skin cancer diagnosis. I am working on a smart app which is about the detection of cancer, melanoma patient mainly. As you know, in skin of color, it isn't a big problem, but in white skin, it is. So we are here to collect data, and then usually make different algorithms with the help of our AI expert team, and then it is improving day by day. Like I have seen 2, 3 models which are already detecting cancer so well in skin diseases, in skin domain, it's like 90% and above. And teledermatology is improving with every upcoming day. So if we look at this picture, it's a single picture, but it's giving us a very good, excellent message that first of all, wait. Yeah, first of all, we are giving this image to our computer and we are using AI models. So first of all, the face will be detected as it is done in our passports and in different machines, they are doing it. Like, and different algorithms like convolutional neural network cascades and multitask cascaded neural networks and two-step detectors, they help us to detect the face. And after that, then is the face alignment. There are different pinpoint positions which help us with the help of heat map regression or coordinate regression. Then is the face alignment. Then is face reconstruction. It is also with different algorithm, and then is the face recognition. Here from the single image, with this single image, we can not only diagnose skin diseases, but also aesthetic problems. Like if a person is treated with some, like for example, with Botox and he got lid ptosis. So, for example, we will see to the ophthalmic diseases. Then we can, with this picture detection method, we can rule out, okay, the patient has liptosis. And if even it is mild, it can be detected. And neuropsychiatric diseases like Parkinson's with the special facial feature, we can diagnose with this single image. And skin diseases like skin cancers, acne, rosacea, then endocrine diseases, acromegaly, like facial features, like we can find out that, okay, it's a broad nose and it's towards acro, and Cushing syndrome, very moon face. So it isn't like we are watching it. In fact, it's something which is done by our computer smartly. Before the patient is arriving to us, he we or our client is arriving to us, he already is being detected by these smart machines, that okay, with the data we can come to know that the patient has Turner syndrome, Down syndrome, or is there any other abnormalities going on, if the patient is anemic. So a small picture is giving us a comprehensive data. And then the visual skin analysis system, we know that it's almost everywhere in all aesthetic big practices. Visual skin analysis is a complexion analysis system that provide us in-depth look at facial skin, and it's actually already based on AI system, and it take a series of photographs that analyze skin pigmentation, spots, wrinkle, texture, pores, vascularities, and porphyrin. So the Visia machine uses three types of lightning, which shows the different features. This include UV lightning to feature not visible to the eye, such as porphyrin and UV spots. Then we have RBX imagings to show red and brown areas. Then we have standard fluorescent lightning for visible features on the face, such as spot and wrinkle. So what's look at the picture, that these are the detection with these three lights: spots, wrinkles, texture, pores, UV spots, brown spots, red areas, and porphyrins. So visual skin analysis provide a visual to the skin, and an easy to understand analysis of any skin issue. But the main thing which we can gather from it is data. Like we can extract skin features which can be used to train advanced AI models for automated skin analysis. Instead of Vijaya, I was in Pakistan and I have only infrared cameras. So what I did, I make a smart system with these infrared cameras, and generated image which show that, okay, my patient is suffering from this skin disease. And I start looking at the images with different diseases, and also with aesthetic practices. Like I was looking, okay, my patient is coming with aging, and I found that maybe he is from Maert's classification 2, 3, 4. Okay, his nasolabial fold is too much, and now it's internationally recognized, and it's working. And now more data is generated. So more data generation means that we are getting more benefit for it. Like in future, AI interventions will give us a big plus to decrease our burden. So as we know that in skin of color, most of the time the problem is post-inflammatory hyperpigmentation after aesthetic treatment. And Nanasan and colleagues, they develop a novel neural network model for predicting susceptibility of facial post-inflammatory hyperpigmentation. What they did, they use an attentive backpropagation neural network model on almost 1953 patients with pigment disorder, including 93477 label data with 8 indicators. And later, what happened, that they find out, okay, these patients, like from their data, that the patients with these features, they are more prone to post-inflammatory hyperpigmentation. But some patients, they are not prone to post-inflammatory hyperpigmentation. So the tailoring of the treatment is really easy now. Like we can, with our previous knowledge and with this AI, we can come to know, okay, this patient is coming to us, and Evidence-based data shows that this patient can have post-inflammatory hyperpigmentation later. Is it mild, moderate, or severe? We have to rule out, and then we can tailor the treatment accordingly. Maybe we can say no to our patient. We can't treat you because it can lead to post-inflammatory hyperpigmentation like carbon dioxide lasers. Most of the time we can say no to our patients, and sometimes we need very mild fluence to treat our patients, and we need multiple sittings. So the tailoring of the treatment is easiest with this intervention. Here it's all about Vizia. On the left side, this is before and after. The left, each picture is taken before treatment, and the right is taken about 1 month after the last treatment. Now, this is a research which is done in Stanford University by Jack Lee and colleagues, and they find out a grading system for acne. As we know that acne is graded into mild, moderate, and severe form. But if we can, before a patient is coming to us, we can come to know, okay, our patient has mild acne, moderate acne, or severe acne. We can tailor the treatment quickly. Similarly, in our villages or maybe in rural areas, this implementation is really helpful. Same work was done by Chinese, and they also make a smart grading system which can now scrutinize what sort of acne a patient has and treat and give the specific treatment which is required for the patient. Instead of the old theory in which we have to wait for longer, and okay, like in big cities like in Berlin, it's really difficult to get an appointment from a dermatologist, and usually it will take more than 3 months if I'll ask, okay, I want to go to a dermatologist for acne treatment. But in this, advancement here in our GP practice, even a GP or maybe a house doctor can at once see, okay, the patient has this grade of acne, and I can, according to the guidelines, I can treat my patient on these lines. Instead, most of the time it happens to rural area. I've seen many patients who were treated with steroids instead of the proper treatment which is required for acne. So this development is not only from aesthetic point of view is better, but it's also better that we can give the right treatment right at the target and at right time. Then is the skin detection. As we know that AI is, predicting Fitzpatrick's skin type, and it's something which was a very initial one. Now, AI can predict not only Fitzpatrick's skin type, pigmentation, redness, and wrinkle severity, but we can also give our information like just um, we can check it with the photograph. Like Grelos has done this research, and the assessment of the skin characteristic is why it is important. Similarly, the reason behind is for the right treatment. Like now there are smart diodes, diode lasers, there are smart anti-jag lasers. What have you seen that these lasers are so advanced that whenever we put probe on our skin, they tell us, okay, the patient has skin type 1, 2, 3, 4, 5, and the treatment can be tailored accordingly. Fluence is adjusted at once. Like in dark skin, the fluence is at the lower side, and in lighter skin, the fluence is sometimes at the higher side. So the treatment is tailored with this intervention so quickly. So it's something which is not new, it's already implemented. Now advancement is going on. So here it's a conference paper by some Indian colleague, and it was interesting that the paper has successfully proposed a convolutional neural network and digital image processing technology, like edge detection to detect and analyze the wrinkle of a human skin based on images. The detection of skin age and wrinkle is actually very important, and whenever a patient come to us, we have to rule out because we have to tailor the treatment accordingly. For this, the convolutional neural network has eased down our problem by founded on skin examples of dissimilar age group. In addition to examination of the lifestyle, the proposed wrinkle detection method leverages a best accuracy in this model by 96%. So facial analysis and morphology, it's something which is really important. Like AI can assess facial symmetry, proportions, and features. Sometimes human eye can miss it, but AI can help us, and this help us in planning our filler treatment, that how much volume on one side is required and how much injectables or surgeries are required. And then is the virtual consultation and predictive imaging help to manage expectations. So this is another one. It's a research which is done by GradCam. Before that, I must want to show you this picture. In this, the skeletal class 1 in the middle show a facial profile in which is really harmonious. Like the upper and lower jaw, they are at equal level and it look pleasant. But if we see on skeletal class 2, there is prognathia, and in skeletal class 3, it's retrognathia. In this grad camp system, they have seen like instead of just skeletal issues, they have noticed the soft tissues mainly. Like GradCam reveals that the cheek volume, forehead, chin, and nasolabial trait could be representative feature of each type. This can aid in orthodontic treatment planning by understanding the facial disharmony that needs to be addressed. They use two models like ShuffleNet model as well as ResNet, and they found that ShuffleNet model is superior to identify skeletal types. And why is it important? Why I'm talking about these things? I'm talking about these things, and if somebody has skeletal deformities, but we can give some soft tissue enhancement with fillers, then he can have desirable effects. Now we will talk about hair analysis. There was a research by Ora Raymond and his colleague. They use artificial intelligence to track platelet-rich plasma treatment outcomes in females with non-scarring alopecia. In this case series, they find out three groups of patients: Group A, Group B, and Group C. In Group A, there's androgenic. In Group A, you can see that the patient has intermediate terminal hair, but the small terminal hair and vellus hair are mild. And in patient B, intermediate terminal hairs are more, but in patient C, vellus hair are more. So after the treatment, in this, they have used trichoscopy to monitor that is the treatment going well by looking at the density from the frontal, anterior, middle, and vertex scalp of the large terminal hair. And then they find out that patient C category, they are not so successful. Why? Because they have more vellus hair. So it's all done by convolutional neural networks. Okay. So AI in treatment planning and personalization. So now AI, previously it was just hype. We can say that maybe AI will implement it in future or maybe not. Now we can see it's an example I have taken from YouTube. It's a short which shows that AI can tailor not only analyze the skin and but also tailor the treatment accordingly, and then pharmacological point of view, it can further advise you the treatment which is rightly required and prepared in front of you which treatment is required for you. It's something which is really new for me, and I haven't seen such practice, but I've seen few robots which are making these medicines and everything, and they are creating serums. But this is something new for me as well. Like AI analyze patient data for tailored plan and then predict treatment responses to optimize result. So AI driven platform personalized energy based treatment, which I have told you before. Look, this is a picture with different points. If you see what's inside, the logic behind is that with AI, we can come to know that where and how much filler is required, or is it required or not required. I use on myself an app, and it wasn't the big one or was created by somebody who's really famous. It was done by some students, and I checked myself and found that my tear troughs are not good, and they're really deep, and I need zero point 0.5 mil on both sides. And it was actually required, but I was really, the person who is really reluctant of these things. So I said, no, it can be dangerous for my eyes. Although, if somebody in good hands can do good for me, but I didn't. But this is something, yes, we can get benefit from these things. Like AI can analyze facial features to identify area needing filler treatment and simulate potential outcomes, aiding in informed decision makings and patients' communication. It can assist in personalized treatments planning by considering facial anatomy, skin type, and patient preferences to formulate optimized injection strategies. AI powered tools can provide real time guidance during injections by overlaying digital markers on live video feeds indicating precise injection point and depth, thus improving accuracy and reducing complications. And this is something which is done with ultrasound as well. Now we have ultrasounds which are AI based, and they guide us very well that where and with ultrasound we can find out, okay, here is a blood vessel, we can't go, and it's a no for these fillers. But we they can also guide us the right position. And in Althera, uh, maybe you know that in Althera actually it's all the system which tell us that where we are where intensity is going, and where micro focused ultrasound waves and these things are going. So similarly, in our fillers, this can be a big intervention if it is present everywhere, in every clinic, that a patient come to us, we give a picture, okay, the picture identify what problem is there, and then this picture can also identify, okay, the patient has this type of aging, we can treat this way. Like a patient is 50 years old, his treatment is entirely different to a patient who is 70 or 80 years old. So these all things can be can be our future, and I'm really hopeful that it can be implemented everywhere. I have shown this picture to you. This is actually the first robotic arm injecting filler. Her name is Lena. And yeah, furthermore, AI algorithm analyze follow-up images to track filler distribution and assess treatment efficacy, and alerting practitioners to potential complications or the need of the touch-ups. Then robotic injectors are integrated with AI softwares, can analyze 3D facial scans to map optimal injection sites and volumes. Technologies like Modiface and Revive AI use simulation to preview facial enhancement during dermal filler consultation and provide precise facial analysis for optimal injection site. AI is being harnessed to revolutionize precision, safety, and personalization in laser treatment. This is something I'm telling you, that with our laser probe, we can have a lot of information nowadays due to these AI-driven tools. So AI-driven skin analysis provide objective and comprehensive assessment of the skin characteristics like melanin level, vascular structures, pore size, textures, leading to more customized treatment. Like AI can optimize treatment parameters such as wavelength, energy level, pulse duration by leveraging data from previous treatment to provide personalized recommendations and minimize risk like post-inflammatory hyperpigmentation. And this research was done by Diala and colleagues. And now it's not only confined to fillers, Botox. In Botox, there is also a beautiful research in which the convolutional neural networks models were used that where to administer Botox so that we can minimize the complications like ptosis, like spooky eyes. These we can cater at once that okay, we will administer our Botox at this point which is required, and sometimes the students or the learners who are beginners, it is very difficult for them to administer Botox and they have unwanted effects. To cater these things, AI advancement is there. Now in facial fat grafting, there is a research paper which also show about that how they work on these, and AI programs are being developed to aid doctor for diagnosing and treating patients needing facial fats grafting. In this paper, they have used AI enhanced two-third guidelines for lipolifting, and they have taken like golden ratios and found that from 2000 to 2022, the data was collected in 2,800 facial fat grafting patients with micro and macro fat filling. And they found that the patients in the range of 1.4 to 1.9 golden ratio, they usually have desirable effect as compared to others. So with this we can also most of the time lipofilling has failures, but if it is administered at the right place, so it can be beneficial. So AI programs are being developed to aid doctors in diagnosing and treating patients needing facial fat grafting and potentially improving precisions and patients outcomes in these personalized procedures. Guidelines for fat injection volumes are being combined with AI to tailor these treatments. Then is the cosmetic development. AI is not only confined to one domain, like AI is particularly used in cosmetic solution preparations as well. Like in this research, Mr. Chen and colleagues, they have worked on efficacy of vitamin B12 and adenosine phosphate in enhancing skin radiance. What they did, they targeted AD, and they found that vitamin B12 um, and IPOR1 receptors. One was agonist for sagging and wrinkles, which is ATP, and the other was vitamin B12, which help in to give the glow. They create based on AI this medicine which has proven efficacy. So AI is now intervened in the preparation of medicine in pharmacokinetics as well as in pharmacodynamics. So AI, particularly deep learning models, is used to identify cosmetic ingredients with specific binding affinities to target receptors, such as those enhancing skin radiance, and the efficacy of these AI identified ingredients is then verified through in vitro and in vivo studies. Here in this picture, if you browse on the pictures, you can see that the application of AI in transdermal drug delivery system. We can personalize medicine, we can screen out the drug molecule, skin permeability, then simulation and virtual testing, then design, and then enhance clinical trial. Mesotherapy, my heart and my other specialty. Mesotherapy with AI precision, it's like 2017, a smart gun, which is Pfizer Alliance, was introduced, and it's really the one which is using AI guided precisions and advanced algorithm. And now more smarter one is coming. So advanced algorithm ensure optimal depth, angle, and volume for each injection. Actually, we usually have a know-how about the subject that maybe mesotherapy is only an aesthetic treatment. No, it isn't. It is everywhere. We are using it in gynecology, in other practices like in internal medicine, in smoking cessation. So these guns, if they are smarter one, they help us to treat and tailor the treatment nicely. PID control, feedback, real-time regulation, and pressure and flow for unmatched accuracy, and adaptive injection profiles like automatically adjust parameters based on skin type, area, and patient's feedback. Then is minimize discomfort. Smoother, faster procedures with minimal tissue trauma, and some are user-centric interface, which intuitive designs enables quick calibration in patient-specific settings, consistent results, which reduce human error and variability, enhancing patient satisfaction as well. So predictive analytic for outcomes, AI forecast treatment outcomes and potential risk. This is something which we have, talked a little before as well, that like in post-inflammatory hyperpigmentation paper, we have seen that if the patient with these parameters are coming to us, they have more chances for post-inflammatory hyperpigmentation as compared to other ones. So AI can forecast treatment outcomes and also the potential risk, and it enhances patient satisfaction and informed consent. So AI in device optimization and automation. AI-driven real-time adjustment improves safety and efficacy. Smarter lasers and adaptive energy-based devices optimize treatment. Then robotic AI-assisted treatments improve precision and consistency. Then is workflow automation. AI streamlines scheduling and patient follow-up. Usually to schedule is really difficult in private practices. This load is really decreased nowadays, and I've seen in my practice as well, we are using some apps which are smarter AI apps, and they are scrutinize the patients, and they rule out what are the patients and their demands, and they previously before coming to us, and they streamline the patient accordingly, and which reduce administrative burden, improve patient care efficiency. Ethical implication. Actually, previously AI work was done in aesthetic medicine, but ethics were not considered as much, and the data was also not so good. What are the specific challenges which we face with AI is number one is the privacy concern. Number two is unverified accuracy. And number three is weak interpretability, and then is model unfairness, and then regulation adherence. So there are some possible solutions, like we take informed consent from the patient if we have privacy concern. Our data should be very private, and face anonymization should be done. Then unverified accuracy, how can we make a solution for these things? Like we enhance data set diversity and data standardization and algorithm solutions. Weak interpretability was previously big thing, like non-medical staff or the patient or people with lack of algorithmic transparency, or who have no know-how on the subject, they were interpreting it. But now we experts are coming forward, so developing explainable AI algorithm, investment in educational program, and encouraging interdisciplinary research will help to cater these problems. Then is the model and fairness, cultivating diverse database, and then regulation adherence is dynamic regulation framework, international standard for AI use, education and awareness, and robust data governance. So data privacy and security, like GDPR and HIPAA compliance should be done. Importance of diverse data set to prevent bias, evolving regulatory frameworks, and AI enhanced but does not replace clinical expertise. Here we will talk about Amir. We team up together, and Amir has two programs. One is the master degree in aesthetic medicine and nutrition, and the other one is international master degree in trichology and hair transplant. And it's actually with 60 it's ECTs, 200 hours of internship, seminars, tutorials, webinars, and personalized guidance divided in 9 modules in total, which are dubbed and subtitled videos in English. The certification is double certification. One is from the University of Madrid, Spain, and the other one is from the Medical University of Lodz, Poland. So one intensive week is in Madrid, which is 60 hours of practical session with real patients, more than 200 models, over 30 medical procedures, and teachers are really experienced. They have techniques. They know the techniques. They know their specialty well, and they are dedicated to clinical practice. So civil liability insurance is their own clinic and materials. This is all. Yes. I know it's really boring subject, but I think it should be addressed so that people can know that what AI is and how can we implement it in future, because it's our future. If you have any questions, you can send me by email, or you can ask me right now.
Uh, Dr. Iram, Dr. Farhan here from Saudi Arabia. I'm from Pakistan actually. Can you hear my voice, please? Let me
Yeah,
know.
I am listening you.
Yeah, Dr. Iram, thank you very much for a nice presentation on AI, a very novel topic. And secondly, I think this is the talk of the town nowadays, use of the artificial intelligence in every field. Yeah, my question is that especially that being an aesthetic medicine, what do you feel that with the AI nowadays taking the roles on in the facial mapping, treatment, planning, and what will be the evolving role of aesthetic physician in the next decade? What is your take on this issue? Because
You know,
especially I was very
actually,
apprehended when I felt when I saw those videos of robotic AI doing everything from for the aesthetic physician. So what is the
no,
exact role for us in the next decade?
aesthetic physicians will always be there. Like any medical specialist, he always be there. We are hand in hand. I have told you before. Yeah.
Yeah, I
And
agree
without
with
these
that.
aesthetic physicians, we can't do, yeah, machines can do so smartly. We need good people like you who can give their input, and we and other community people make smart programs so that it will be helpful to us actually to decrease the burden to our practices in future.
Hmm. Well, frankly speaking, I still have my apprehensions about this, about our
No,
roles
I think
as
you
aesthetic
shouldn't,
physician.
because it's something, yeah, a human brain can't replace with these devices, yeah, but we can
Mm,
make more smarter one by working, together.
mm.
There are people who
Okay,
are really reluctant to have these, like it's something I have told you that with the example of washing machine. New interventions
mm,
are usually difficult to digest, but with the passage of time,
mm,
they are those people who are opposing them. They always have something new with them. Yeah,
fine. So, Dr. M, my next question is about Vizia. So, are you using this device,
yeah. In
Vizia
our
skin
clinic, we do
analysis?
have. Do you have to?
And no, actually, no, I don't have it. And my second question is, what is the cost of this Vizia? Do
Actually,
you have
I'm an
any
employee
idea?
there. I can't say anything.
Fine, it's all right, no problem. And talking about the master's programs in aesthetic medicine that you have introduced at the end, what is the can you tell us the fee structure about that, or should we have to contact
I
some?
think Christina will help you in this.
Fine.
Christina, could you please answer it?
Yes,
Yes,
hello,
Christina.
hello. Nice to meet you.
Hello.
I'm
Yeah,
the
me
part of
too.
Amir. I was enjoying the webinar as well, all together with you guys. Please tell me what was your questions about Amir, and I will try to give you the answer.
Yeah, actually, my question was about the fee structure about the master's program in aesthetic medicine.
Okay, so the price in total is 6,500. You can start study from the first day. You can do 18 payments. You can start the payment this month, and then you can pay every month till you will start your practice in November in 2026. You can start to learn theory from the first day of the payment, which is 500 for the registration. It's a registration fee. And then every month you can continue your payment to continue the courses and to join the practice week in Madrid in November with us.
Fine. And I would appreciate if you can share your email or some contacts so that the participants who are interested, they can contact you regarding the any more information or details.
Of course. I will share with you guys in the chat with everyone who would like to join the Amir. And I also would like to tell you that Dr. Iram has her own discount. Yes, 15%. So for everyone who joined today, the webinar, if you will subscribe with the name of Dr. Iram, you will receive 50% discount on the 6,500 fee. So yeah, I will leave you the discount code and I will leave you the contact number where you can find out more about Amir program.
And I'm really
Thank
thankful
you,
to all my
Tina.
Pakistani and Saudi Arabian colleagues. They are, it's 8 o'clock here, so I think. What time is right now? Yeah, Farhan?
Yeah, in Saudi Arabia, it is almost 10 o'clock. I think 10 minutes remaining. Probably, yeah, I think it's 10 minutes to 10.
I'm
Yeah,
really
they're not.
thankful to you. And
So
it's
it's
really
my pleasure.
tiring for me, and I didn't prepare anything, and it was at once, but yeah, okay.
My
It's all
pleasure. Thank
done.
you.
And
Once.
thank you so much. Thank you so much. Any other question? Those who want to ask any technical question, maybe they can send email to Christina or me. I will answer them accordingly.
Okay, guys, I just share with you the discount code that you can use while you will be registering for our course. And also the contact WhatsApp number where you can find me and ask me any questions. And also my email where you can also type me with any questions. Feel free to type me to ask me for anything you need. I will try to respond all your questions. I will also, guys, to send to everyone the recorder of this webinar tomorrow. I will prepare the message for you. So I will remind you the discount code as well, and feel free to answer this message because I will type you on a WhatsApp tomorrow. If no one, thank you as well. If no one have more questions, I think we can finish for today our session. We thank so much everyone to join us, and especially Dr. Iram, our new collab that we have. And I think in the future we will have more and more interesting webinars, and we will be happy to see you guys.
Goodbye. Have a
Okay.
nice evening.
Yes. Have a nice evening to everyone. Thank you. Thank you. Bye.